I was just desperate, damn near willing to try anything. Voodoo, you name it, I would have tried it. I could barely walk getting up the stairs. There was a profound limp. I was in pretty severe pain. I can feel fairly normal, and then out of nowhere comes a very, very sharp pop or snapping sensation in the groin area. It's akin to like being stabbed with an ice pick. On a 1 to 10, 8 or a 9. I've noticed almost with each treatment improvement in my symptoms. Today it would be less than a 1. It's incredible. I've been dealing with this particular chronic pain for over a year now. Groin pull, that would be probably the most common description for it, and a snapping hip, which is like a clicking or a popping sensation in the hip area.
One of the things that I'm always concerned with when people are limping is the labrum, the cartilage degenerated. So we did the full exam, and it did look like he had this snapping hip syndrome diagnosis. The internal one where there's an iliopsoas bursitis right around his psoas muscle around L3. He also is a very busy man. He has all these projects that he's got to finish. Chris, you got to fix me so I can finish my projects. It's like, okay, I'm with you, Joe.
I could get on a bicycle and just go out on a Saturday for a 50 or 60 mile bike ride. And then of course I'm an avid carpenter and mason and, do all sorts of construction projects in and around the yard. I basically was very, very limited in what I could do because of, being in a constant state of pain. I contacted a friend of mine who is a licensed massage therapist in New York State. We discussed the symptoms, and she had suggested, after having watched a number of videos on YouTube of Dr. Steppian's treatment for muscle adhesions and nerve impingement, that perhaps this might be a better fix for me than just traditional Swedish deep tissue massage. My first impressions when I came to Barefoot Rehab was what a wonderful group of people, very welcoming, very calm kind of environment. Warmth, I guess, would be the best way to describe it. This was, not your standard or traditional type of care.
He is 90% better overall with his symptoms. He's able to do a lot of activity. He's not really limping anymore. He's sleeping much better. And so the thing with diagnoses like snapping hip syndrome or hip arthritis is it could be a combination of all this stuff.
The doctor suspected that I had some type of hip joint damage. The orthopedic surgeon that I had gone to, who did an x-ray, had said that there was no osteoarthritis in the joint, but he did not look at the soft tissue. Dr. Steppian believes that that's probably where the problem lies therein. He has prescribed an MRI. I have yet to be able to get the insurance company to approve that and advance with the MRI, which we will eventually. And we'd like to either, rule that out, that there is no soft tissue damage, or confirm that the doctor's diagnosis, and then there's a course of treatment that can address that issue.
Thank goodness he had a lot of adhesion in his nerves, the femoral nerve next to the psoas, the obturator nerve in the proximal anterior thigh, the femoral nerve at the inguinal ligament, the superior and inferior gluteal nerve at his gluteal area, piriformis, the sciatic nerve at piriformis, which he actually had, which isn't super common. Thank goodness he had a lot of these adhesions because his symptoms were responding great. We will see where this case goes with Joe just because we haven't had the MRI, and we're going to see how much of this stuff lasts. But if it's just the bursa underneath the psoas and iliacus, then he's likely going to get sustained relief. That psoas muscle around L3 really needs to relax for him to have sustained relief and not be in here for maintenance treatments once every 2 weeks or every month. So hopefully I'll see him less than that if we could figure out how to get that psoas to relax.
So now that I've had a reduction in my pain and I'm feeling somewhat more normal, I think I'm going to very carefully go back into, the bicycling again. The doctor's guidance has been, to kind of like take it easy and not go overboard. So I have a hard time doing that because I tend to approach things, head on. It's going to require some patience on my part, not one of my stronger traits. I would recommend anybody who's experiencing pain that they have not been able to get treated through their traditional doctors or traditional methods. Anybody that is trying to do things naturally and healthfully, this I would certainly recommend too.
If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with adhesion release methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.